Hello guys, now in this video let's discuss about cortisol. Cortisol is also called as stress hormone. Okay, and this cortisol will show diurnal variation. What exactly is this diurnal variation? Which means in this 24 hours of a day, certain times the cortisol levels will be increased and certain times the plasma levels of cortisol will be going down. So you can see the variation in the levels of cortisol in the blood. So this is called as the diurnal variation. Now we will see highest levels of cortisol in morning 8 a.m. Why? Because it's a stress hormone, right? So in the morning, cortisol will be elevated in your blood, making your body to encounter the stress. So you have to go to the work, right? So cortisol will come, it will increase the blood glucose levels and prepares your body to encounter stress or the daily activities. Okay, and low levels of cortisol is going to be seen in the morning 4 a.m. That time we don't have any stress, you are absolutely sleeping. So least amount of cortisol will be seen in the morning. Now let's talk about the cortisol action on different substances. For example, what happens to proteins? Okay, let me write it down here. Now, if cortisol is acting on proteins, proteogenesis will happen or proteolysis will happen. Cortisol is one of the catabolic hormone. So, proteins especially in the muscles are going to undergo broke down, that is proteolysis will happen on muscles. But if the cortisol, if it's acting on liver, it helps in production of plasma proteins, increases the synthesis of plasma proteins. Okay guys, now after this let's talk about the actions of cortisol on carbs, carbohydrates. Now what happens? Under the action of cortisol, there will be increased glucose levels. The glucose will be elevated. How? By the process called as glycogenolysis. Okay, with the help of glycogenolysis and gluconeogenesis. Okay, so glucose levels will be elevated. Now let's see what is the action of cortisol on lipids. So there will be lipolysis. Lipids will be broken down into free fatty acids. So free fatty acids level will be elevated whenever there is cortisol because of lipolysis. Now after this, let's talk about cortisol action on adipocytes. See guys, this is very important. Normally, whenever there is cortisol, I have taught you, whenever there is cortisol, it's a glucocorticoid, right? Cortisol increases the blood glucose levels. Okay, very simple. Cortisol, it's increasing blood glucose levels. Okay, blood glucose levels are elevated. When blood glucose levels are elevated, automatically what happened to insulin levels? Insulin levels also elevated. Now this insulin will act on adipocytes, especially in the center of the body, and there will be hypertrophy and hyperplasia of these adipocytes that will cause centripetal obesity. Okay, now imagine if a person is having too much amount of cortisol, especially in Cushing syndrome, right? So whenever there is too much amount of cortisol, how the patient will look? Now this excessive cortisol will increase the blood glucose levels. Whenever there is more blood glucose levels, there will be more insulin. that insulin stimulates the adipocytes, so that what happens? The adipocyte hyperplasia and hypertrophy will occur, that will cause centripetal obesity. Okay, the adipocytes in the tummy region, in the axial skeleton, especially around the tummy or the abdomen, will undergo hyperplasia and the person will have obesity. Okay, it's a centripetal obesity. Why only centripetal obesity? Because cortisol is acting on the bones, cortisol is acting on the muscles. Now, if cortisol is acting on the muscles, proteolysis will happen. So, in the limbs, because of the proteolysis, the extremities will become thinner. The patient is going to have a very thin extremities, but if you look at the axial skeleton, the person is having obesity. Okay, so that is called as centripetal obesity, which is seen in Cushing syndrome, cortisol excess. Now, let's talk about actions of cortisol. Actions of cortisol on different parts of the body. First, let's talk about bones. Now, what happens to bones under the action of cortisol? In the bones, we know there are two types of cells, osteoblasts and osteoclasts. Osteoblasts are the ones which forms the bones and osteoclasts are the ones which breaks down the bone or causes the resorption of the bone. Now, cortisol will act on the bone, activates osteoclasts. Okay, osteoclasts are activated. Whenever osteoclasts are activated, increases bone resorption. Okay, whenever the bone resorption is increased, that causes osteoporosis. So, you should know that a patient who is suffering with Cushing syndrome will be having a clinical feature of osteoporosis. Why? Why? Because cortisol activates the osteoclasts. And also, cortisol is known to be anti-inflammatory in action. Why? Why it is anti-inflammatory? Because cortisol will decreases levels of prostaglandins. Okay, especially prostaglandins levels will be decreased. Phospholipase A2 levels will be decreased. Histamine levels will be decreased, and even thromboxane A2 levels will be decreased. Interleukin 2 levels will be decreased. Now, all these are actually inflammatory mediators. If you decrease the levels of inflammatory mediators, automatically inflammation will go down. Okay, this is how cortisol is acting as anti-inflammatory agent. Now, let's see other actions of cortisol. Now, if it's acting on bones, what will happen? We have seen. Now, we will see cortisol action on blood vessels. Now, whenever they are acting on blood vessels, they will cause vasoconstriction. I should say, whenever cortisol is acting on the blood vessels, the smooth muscle of the blood vessel, it will become more sensitized to catecholamines. Okay, so whenever it is becoming more sensitized to catecholamines, it can easily undergo vasoconstriction. That will increase the BP. Okay, normally cortisol will cause vasoconstriction and increase the BP. If a person is having Cushing syndrome, definitely he will be suffering with hypertension. And cortisol action on stomach. Okay, in stomach, cortisol will increase the acid production. Okay, this is what happens in a normal person. Now, imagine that there was this one patient who is suffering with a Cushing syndrome. Now, in Cushing syndrome, we know there is too much amount of cortisol, and whenever there is too much amount of cortisol, that will increase the acid production inside the stomach, that will cause peptic ulcer disease. Yes, excess cortisol can cause peptic ulcer disease. And let's see the action of cortisol on reproductive system. Reproductive system. Now, what do you think? Cortisol is a stress hormone. During a stress, do you need a reproductive activity to be happening in the body? Definitely not, right? So, cortisol will act on reproductive system, decreases the gonadotropin releasing hormones. So, GnRH levels will be decreased. So, whenever GnRH is not there, there is no FSH, there is no LH. So, there is no ovulation, anovulation will occur in the female, anovulatory infertility will occur. So, imagine that there was this one female who is suffering with a Cushing syndrome. In her body, GnRH levels are low. GnRH is not there, there is no FSH. If there is no FSH, follicular development is not there. So, estrogen levels will be low. And also, whenever there is no LH, ovulation cannot happen. If ovulation is not there, she cannot have her normal periods. So, she will be suffering with amenorrhea, and definitely she cannot have a pregnancy. So, she will also be suffering with infertility. All these are the symptoms or the clinical features which can be seen in cortisol excess, that is Cushing syndrome. Okay, so see, very simple. Cortisol acting on blood vessel, making the blood vessel more sensitive to catecholamines. By that increases the BP, or you can say cortisol maintains the tone of the blood vessels. Okay, acts on reproductive system, or it inhibits the reproductive system. And by acting on gastric mucosa, it increases the acid production. Too much amount of cortisol can cause peptic ulcer disease. Now, let's see cortisol action on WBC. So, guys, it's very, very important. Now, cortisol will increase a certain type of WBC and will decrease a certain type of WBC. Cortisol especially increases the neutrophils, and the same cortisol will decreases the eosinophils. Okay, now by acting on blood vessels, I have already taught you, it increases the BP. After this, let's discuss about clinical features in a patient who is suffering with Cushing syndrome. Cushing syndrome. What exactly is Cushing syndrome, guys? Cushing syndrome is a condition where there is excessive amount of cortisol, increase cortisol. Now, why there is increased cortisol or why there is increased glucocorticoids, that we will discuss in the next slide. But increased cortisol will causes Cushing syndrome. What are the clinical features? Let's start with the hypertension. A patient with Cushing syndrome will have hypertension. Why? Because cortisol sensitizes the blood vessels to catecholamines. So, blood vessels will undergo vasoconstriction, that will cause hypertension. Now, after this, these patients will be having muscle wasting. Why they will be having muscle wasting? Because cortisol acts on the muscles, will cause proteolysis. So, excessive cortisol will cause excessive wasting of the muscles. So, the patient will be having very thin muscles, that's called muscle wasting is happening. Okay, that's why muscle wasting is happening. And the patients will be having, I have already taught you, the patients will be having centripetal obesity. And also these patients will be having buffalo hump. Okay, it's nothing but deposition or proliferation of adipocytes, especially on the back. That's causing the buffalo hump. And the proliferation or the hypertrophy of adipocyte, especially in the face, will give moon faces appearance. Okay, round faces. Okay, the patient will be having a moon's face. And because of the centripetal obesity, the abdomen will stretch too much, giving rise to abdominal striae. Okay, now apart from abdominal striae, the patient will be having easy bruisability. Now, why the patient is having easy bruisability? See, cortisol, it acts on proteins, causes proteolysis, destruction of proteins. Wherever the proteins are there, the proteins are getting destroyed. Even the blood vessels are made up of collagen, right? Collagen is also a protein. So, even the collagen is under attack. So, blood vessels become more friable. So, this cortisol will cause easy damage to the blood vessels. So whenever the blood vessels are getting damaged, blood is going to leak. That will cause easy bruisability. Okay. Now, let's see a few more features. After easy bruisability, these patients will be having immunosuppression. Okay, because the glucocorticoids are immunosuppressants. Now, these patients will also be having hyperpigmentation. Okay, why these patients will be having hyperpigmentation, we will discuss in the next slide. The hyperpigmentation is especially because of the excessive levels of ACTH. Okay, what that excessive ACTH will do, just wait for a few minutes, we will discuss. Now, a patient with Cushing syndrome, he will also be suffering, or especially she will also be suffering with amenorrhea. Why she will be having amenorrhea and infertility? Because cortisol will inhibit the release of gonadotropin releasing hormones. So whenever there is no gonadotropin releasing hormone, there is no FSH and no LH. Whenever there is no FSH and LH, ovulation cannot happen and she cannot become fertile. Okay, she will be suffering with amenorrhea and infertility. I have already taught you cortisol will act on the gastric mucosa, increases the acid production. So when in the Cushing syndrome, whenever there is too much amount of cortisol, there will be too much amount of acid production. That too much amount of acid production will cause peptic ulcer disease, and last but not the least, these patients will also be suffering with osteoporosis. And last point is, see, it's a glucocorticoid, right? Cortisol is a glucocorticoid, but it also shares certain features with sex corticoids. Okay. Now, in excess amounts, these glucocorticoids will also show actions like sex corticoids. So, if a female is having this Cushing syndrome, now because of too much amounts of cortisol, she will have hirsutism. What is hirsutism? Excessive growth of hair on the face. Why hair is growing on the face? Because cortisol is now acting like sex corticoids. Sex corticoids, especially male sex corticoids, are the ones which causes hair growth. So, excessive cortisol is acting like male sex corticoids, giving excessive facial hair. Guys, you can clearly see here, this female, now she is having moon faces because of the hypertrophy and hyperplasia of adipocytes in the face. And here this is the image depicting the patient is having centripetal obesity. In the central axial skeleton, the patient is having obesity with abdominal striae. Here this is a real image where the patient was depicted with appearance of lemon of stick appearance. Just see the central body, the central axial skeleton of the body, it's having obesity. And you can see the patient limbs are very much thinned out because of the muscle wasting, because of proteolysis. Here you can see a female with the excessive facial hair. This excessive facial hair is called as hirsutism, and that's because cortisol is acting like sex steroids. Okay, so this appearance, which is called as a lemon on stick appearance, is just like the center of the body is looking like a lemon with limbs looking like sticks attached to it. Sticks attached to a lemon. This is a classical appearance. Now, here you can see the patient hands are having hyperpigmentation. So, why there is hyperpigmentation in a patient with Cushing syndrome? Hyperpigmentation is because of excessive amount of ACTH. Okay, imagine that the patient is having a tumor in the pituitary gland. Okay, tumor in the pituitary gland. Tumor to the, especially to the corticotropes. Now, this tumor is producing excessive amount of ACTH. Yes, this excessive amount of ACTH is also going to act on the adrenal gland, especially zona fasciculata, and from there excessive cortisol is coming. But right now our point is why there is hyperpigmentation. This excessive ACTH can also stimulate melanotropin receptors. Okay, so melanotropin receptors can be stimulated because of excessive amount of ACTH. So whenever melanotropin receptors are stimulated, we know, right, melanotropin receptors. So they will produce excessive amount of melanin that will cause hyperpigmentation. Okay, this is the reason. So hyperpigmentation is because of excessive amount of ACTH. Now after this, let's see what are the causes of Cushing syndrome. The most common cause is iatrogenic. What does it mean by iatrogenic? The patient was prescribed on glucocorticoids. Okay, now if this patient is consuming excessive amounts of glucocorticoids, now these glucocorticoids are causing Cushing syndrome in the patient. Okay, excessive consumption of the glucocorticoids, that is the iatrogenic cause, and other causes includes ACTH producing tumor. ACTH producing tumor, where in the anterior pituitary. Okay, so these are some important causes. Okay guys, hope the video is helpful. See you in the next video. Thank you.